Testing, testing, 1, 2, 3. Testing, testing, 1, 2, 3. Testing, testing. Hello, everybody. Can you hear me? Am I audible?
Yes.
Okay, good. All right. As long as I can hear you and you can hear me, that's all that matters, I guess. All right. Let's see. I got a couple more people joining us all of a sudden. So let them in. Okay. How is everybody? Let's see if I want to see everybody at once. There we go. All right. Hong Suk, welcome. All right. Maritza, this is the first time I get to see your face, yes? Last time I didn't get to see your face. And then Mariana's coming back in. All right. Well, the plan for today is to go from 7:30 to 9:30. That's only because Oriana had already scheduled a bunch of people, a bunch of you for 7:30 before, and we didn't want to make any confusion, but I think everyone got confused anyway. So is 7:00, 7 to 9 better for everybody? Anybody have a preference on that?
I'm open for any time.
Okay.
I think
So how many?
to 7 to 9, but I don't know if he's here today or not.
That's right. Hopefully he joins us. We've got 7 of you. All right. Well, let me adjust one thing here on the sound that I didn't notice until just now. All right. Okay. That should do. All right. Well, I want to, oh, we got somebody else. I want to do a small review of everything just to see if we can make sure everybody's on the same page, because a bunch of you are in different trainings. And so I'm just going to ask a few questions and see if you guys can answer. So get ready to unmute. Let's see here. Difference between an interpreter and a translator. What's the difference?
Talking and reading.
Talking and writing, right?
That.
Talking and writing. So you written document, but I suppose sight translation would be considered reading. But yes. All right. What is in the medical interpretation? True or false? Everything needs to be word for word, literal.
False.
That's right. False, right? We want to make sure that we're conveying accurate information and that we have the correct understanding. So our job is to facilitate understanding, not just repeat words. Let's see here. 4 barriers to communication. Who can name them all? This one's hard.
Language, register, cultural system.
Perfect. Language or linguistic barriers are the difference in the languages, two different languages. Register is the level of the language, right? How complex the language is. Cultural barriers is differences in cultural understanding, and systemic barriers is when either the system or discrimination or just navigating the way healthcare is done in the United States causes a barrier. So those are the four barriers. What about the four modes of interpretation? Four roles, sorry, not modes. Modes is different. The four roles of interpretation.
So you have conduit,
Conduit,
clarifier,
clarify,
culture broker,
cultural broker,
advocate,
and advocate.
Mhm,
Yep, those are the four. So conduit has to do with being that just direct connection, that direct connection between the two languages. You're basically, in a way, just repeating what is being said in the other language. And then register for clarifying is when you change the complexity of the language. Hansu, can you hear us now? Okay, good. All right. Good. Oh, we got mud. And the other one is culture. Cultural broker is helping make sure that they understand each other's culture, and advocate is helping the patient navigate the system. This is more than just communication. So incremental interpretation, or sorry, incremental intervention. How would you guys define that? Oh, we got Santiago. There we go. That's 8 of you now.
That's just taking small steps before you completely intervene or advocate.
Yeah. You don't jump straight to advocate. You take one step at a time, and you try and stay in the conduit role as much as possible. And go back to the conduit role as soon as you possibly can. And you just incrementally jump to each level and try to stay out of the advocate role unless it's really, really necessary. The roles are different depending on where you're at. So this is very specific to medical. Obviously, there are different things if you're in social work or community or working with refugees, that might be a little bit different. We're specifically focusing on medical forms of interpretation. So, okay, and so now we have the four modes of interpreting. Do you remember the four modes?
They're consecutive, simultaneous, summarizing, and sight translation.
Yep. So consecutive is when you take turns talking. Simultaneous is when you're talking at the same time. And summarizing is just making sure everything in the room is understood by everybody, even if it's just to make sure so there's full transparency. And then sight translation would be when you read a document into a different language. So, all right. So that is the 3 modes, 3 barriers, and 3 roles of an interpreter. We talked about a conduit being interpreting everything that's said, even tone and body language and inflection and volume. We talked about how to intervene gradually and when it's okay to lower the register a little bit to make sure that it's clearly understood. how to check to make sure everyone is understanding and reading body language. And so that's kind of where we're at with that. That's basically what we've covered so far, other than the code of ethics. Do any of you guys have any questions about any of those things? Maybe you've had some experience interpreting and something happened and you're curious, but any questions about consecutive, conduit, intervention, or any of those topics? Nope. Good. Just keep going. All right. Okay. So, today I want to talk a little bit about your memory and keeping your memory sharp during an interpretation session, and how to keep up with things like note taking, and how to not leave things out. And so that's kind of where we're going to be today. So I'm going to share my screen and just use just Microsoft Word, I think, is going to be the easiest for us, the way I want to do this today. So okay. So the first thing I want to talk about is the kinds of memory that we have. When it comes to, I don't know that we're going into literal brain structure here or psychological actual studies so much as just a way to frame the way our minds work. And hopefully this will help to be able to understand how to better manage an interpretation session. So when it comes to your memory, in interpretation, there is very short-term memory. And these are the kinds of things where you can only keep so many things in your mind at one time before you start to forget them. The best example of this is a phone number. So for short-term, very short-term memory, usually you can keep things in your head for about 7 to 8 digits in a phone number. And after that, either most people need to write it down or need to have it repeated or need to do some other techniques. And so that can either be 7 to 8 words, or that could be 7 to 8 numbers in a phone number. Usually this is about 5 to 7 seconds worth of speech before your mind starts to forget what was said before that. This is why we don't use simultaneous in medical interpretation as much as possible, because you will start to forget after about 7 or 8 words, especially if it's high stress, something in the ER, or just mental health that could be a little bit tense. It could be very easy to start to forget those things. So for phone numbers, what do we do to remember more than 7 numbers?
We
We do
usually tend to
something,
write them down.
either we write them down. So this is why you do want to have a notebook, so that if, especially when there's lists of things being given or numbers being given, that you can actually start to write down, because if it goes beyond 7 words or numbers, you're going to start to forget. So definitely keeping notes when it comes to lists of things. The other thing we do, like with phone numbers, is we chunk things up. It's easier to remember. I don't know whose phone number that is. I just made it up. But that's harder to remember than breaking it up with dashes. Even that is easier, right? 2983 is easier than 2983. Two numbers in our mind. So we tend to chunk things up, and that helps us to remember a little bit better what is going on. So just a second, I got somebody trying to get in, looks like. All right, so that is very short-term memory. Then beyond that is just your typical short-term memory. And these are concepts that you can hold in your head. Maybe you can't remember more than this many digits in your head before you start to forget, but you might be able to keep general concepts in your mind for longer than 5 to 7 seconds, for a minute or so at a time before it starts to fade. And if it's not repeated, or if it's not used, it won't get stored into your long-term memory. So there's things that are happening. You might be able to remember the gist of an interpretation session, but to go through a word for word, you wouldn't be able to do that. And the longer it goes from interpretation to interpretation session, the more you will forget details, because not everything gets stored in our long-term memory. So some things need to go in our long-term memory, though. And when it comes to long-term memory, we're talking about vocabulary. We're talking vocabulary. Wow. There we go. Your medical terminology, things that you're going to have to remember often. These are the things that you want to keep in your head for a long time. And so this is a totally different skill than short-term memory. Short-term memory is for immediate, and very short-term memory is for super immediate. So it's important that you learn to develop all of these things. I want to talk mostly about short-term and very short-term memory. When we talk about medical terminology a little bit, we'll spend some more time on long-term memory for medical interpreters. But your ability to use your short-term memory is crucial, which first of all means that you have to take care of yourself. You have to get enough sleep. Your short-term memory is in your prefrontal cortex, where you have a lot of that going on right now, that active thinking process going on, and your prefrontal cortex can actually shut down when you are sleep deprived, or other things going on, even just too much stress. Your ability to interpret at a quality ability depends on how well you take care of your body. And so that's number one, is take care of yourself, be healthy when it comes to stress, when it comes to food, when it comes to rest, so that your brain can function to its full capacity. The food you eat affects your brain function. And sometimes I think we only think about food and whether we gain or lose weight or not. And the fact is, what we put into our body can affect the speed at which our brain can think and recall things, and the creativity that we might need when it comes to putting together language in an efficient way. So take care of yourselves. Eat well. Learn what helps feed your brain, so that you can have a fully active, clear, crisp mind when it comes to your short-term memory. That's first of all. But when it comes to techniques, there's some techniques that are really important. And the first one is concentration. This is the most important, is being able to hold your focus. You can't get distracted. You can't be thinking about other things when you have a patient trying to describe their symptoms, or a provider trying to figure out what's going on. And if your mind is elsewhere, then that can affect the quality of the interpretation, the communication, and you don't want to be able to do. So you want to come with the ability to concentrate. The next skill would be visualizing. This is rather than trying to remember words while somebody is talking, you actually have a picture in your mind. It's easier to describe a picture in another language, second language, than it is to remember words. But if you have that visual imagery in your mind, and you can kind of play a video, you can describe that a lot easier than you can by just trying to remember the words. Words are very abstract, but visual imagery in your mind is very real to our mind. So I have a small exercise. This is kind of silly, but it's fun. I want you all to close your eyes, and I want you to imagine that you walk into your kitchen and there is a fresh, crisp lemon laying on the counter. And you grab that lemon, and you can feel the texture on your hand, and you can kind of feel that the slightly oily, you can kind of feel that moist juice on the outside from the skin. And you pick up the lemon and you put it up to your nose, and you can smell that skin of the lemon. And then you go to your drawer and you take out a knife and you put that lemon on the counter, and you slice down slowly halfway in to the lemon. And while you're slicing down, the juice splatters up onto your face and onto your lips, and you can taste it and you can smell it. And then you pick up that lemon half and hold it up to your nose and smell the inside of it. And then you open up your mouth and you take a big juicy bite right down into the lemon. And I saw all of your faces. Everyone's faces showed it. This is how real the mind is. How many of you guys could actually taste it? Your brain cannot tell the difference between what is real and what is vividly imagined. Your brain is very powerful. And this is why, as you're in an interpretation session, if you can create visual imagery, you will find it much easier to be able to keep up with all the interpretation that you're trying to do, because it can be recalled visually way easier than it can be any other way. So that is a huge skill, is being able to visualize. Something else that will help your short-term memory is repeating key phrases. There are some things that providers say a lot. There is a lot of language that's used over and over and over again, that if you can learn to repeat those things in your mind, the repetition creates pathways in your brain that can trigger those memories whenever you need them. And so it's important that you develop some of those neural pathways by repeating key phrases. So something you can do is, after an interpretation session, think of some of the things that were repeated or said over and over and over again, write those down, and practice those phrases, or at least write down a translation for yourself and practice those in your mind, so that when you hear these, some of these things become automatic and you're not trying to remember how to say this particular medical phrase that every single doctor uses, and you're having to interpret it over and over and over again. It's better to just have some of those things memorized so that you can not have to think about it. Anything you can automate in your mind is that how you spell automate? I don't care. Pretend it's spelled right. Is it spelled right? It is spelled right. Anything that you can automate in your mind will speed up your short-term memory. That way you can put your effort on things that will require mental effort. Interpretation is taxing on your brain, and anything that can be automatic frees up that energy for you to be able to focus on the things that you need. Here's another one. One skill to keep track of things during an interpretation session is counting, actually numbering things in your mind. And sometimes you can use this with notes, but sometimes people are talking too fast and you can't write everything down. But it does help if somebody's making a list of things to number them in your mind or number them even on a piece of paper. And even if you're not writing everything out, if you have it counted and listed and connected to a number, that can trigger your memory as you start to repeat back what's being said. And so listing numbers as things are being related by somebody is very helpful. And this can be mental. This doesn't have to be written, but this can be a mental list with an actual number. That the number triggers the memory of what they said. What was the first thing they said? What was the second thing they said? What was the third thing they said? If you have it structured in your mind that way, it will help. And this kind of goes along with visualizing. So if somebody's making a list of things and in your mind, you have one image for the first thing and a second image for the second thing and a third image for the third thing. And for every single one of these, there's an image connected to the number. It's really easy to go down the list and you're not having to remember words, but you remember the image and the image triggers the memory of exactly what was said. So some of these go together. Visualizing and with pictures and listing things out in numbers. Writing down the number might be helpful. Even if you just write down one and then one word as you're taking notes. You don't have to write down every single word somebody's saying because you just need to be able to trigger your memory just enough to remember what they just said. And that may just require you to write down one word or even the first couple letters of a word. If somebody's talking about my shoulder hurts and they're talking about how you don't have to write the whole word out. Let them talk, list it out, and then hopefully that will trigger the memory of what was said. So my shoulder hurts. I fell down. I cut my knee. As you're going through, there's no reason to write out the entire sentence, but numbering it can help. The other one for short-term memory is word association. And that is when you link words that are being said to other things that you can remember easier. You're making connections with words that you're more familiar with. And that would help you be able to trigger your memory of what is being said. So those are the main forms of short-term memory development. I want to show you a couple things you can do to practice these. So I'm going to go back up here to concentrating to avoid being distracted. Um, it's really important that you learn to focus and concentrate, but also that you clear your mind. Have any of you done any kind of meditation? If any of you have done mindfulness meditation, some people, there's different forms of it. Usually it's practicing focusing on one thing. And if your mind wanders, you just draw your attention back to that thing. And this, by the way, has helped many people overcome a lot of stress, just learning to focus on an object. And when your mind gets distracted, bring it back to that object. And when your mind gets distracted, bring it back to that object, and keeping all your judgment out of it. Learning to have that kind of a focus where you can just bring your mind, align it back with where you're at and clear it of the other thoughts that are coming into your mind is a huge skill that is worth developing, not just for interpretation, but for your life. And that will be able to help you be able to clear your mind and focus on what's being said at the moment. The hard part about this is judging yourself. And when you judge yourself, you start to create a lot of stress. And you don't want to add stress because that shuts down your brain. So as you're learning to focus and bring your mind back to the conversation that's happening in the room, don't feel guilty or, oh, I'm going to forget, or I'm so distracted. Just learn to just bring it back without any emotions or stress attached to it, and you'll be able to focus better. You might have to learn to silence your inner voice. We talk to ourselves a lot in our own mind, and it's important to not have simultaneous interpretation going on in your head where you're talking to yourself on top of them, and you can distract yourself just by talking to yourself. And so turn your inner voice off and just bring your mind back to what is being said. So some skills to practice this. The one thing you can do is, whether you're driving in a car or listening to the radio or watching a movie or a TV show even, is to learn to repeat back exactly what is being said. Not interpret, just repeat it back. If you're listening to an English movie, repeat out loud what they're saying and just keep going. And you can do it under your breath. I don't know, annoy your family, they'll love it. But if you're repeating what's being said in your mind, this will help you develop this ability to focus, to repeat back something like, we call it shadowing, where you're shadowing the language. And so you can do this with radio, with TV shows, with movies. You can do it in everyday conversation. You don't want to do it out loud in this case, because that's weird if you're repeating what everybody's saying back to them. But in your mind, if you're repeating what they're saying, that helps you maintain focus, so that when you enter an interpretation setting, you've developed that ability to repeat what they're saying. And then do that in both languages. So watch a show in English and watch a show in your native language, or Spanish or Korean or whatever it is, and repeat back. Do the same thing, exact same thing with both languages. Don't interpret. This would be practicing your concentration skill for short-term memory development. And this would be very, very helpful to do this even for a couple minutes a day. Turn on the radio in the morning or the news in the morning while you're getting ready in English and repeat it for 5 minutes, and then switch it to a different language and repeat it for 5 minutes. And just doing that here and there throughout your day can develop your ability to concentrate and keep your mind on the conversation that's going on. The next step, once you're shadowing the language that's being spoken, is to actually practice simultaneous interpretation. Even though we don't use simultaneous interpretation, because you can miss things in a medical setting that you don't want to miss. When you are interpreting simultaneously with the same thing, a show, a TV, a radio, or a movie, if you're interpreting that simultaneously, even just a few minutes a day, 5 to 10 minutes a day, this will train your mind to stay focused on the conversation and interpret. And so these are some, in fact, these might be the most relevantly helpful to develop your interpretation skills for concentration, is repeating and shadowing what you're hearing, and then practice simultaneous interpretation. So I would definitely try that. Okay. we're going to practice visualizing. So I want you to visualize. I want you to tell me what pictures pop into your head as I read this to you. And hopefully these are things that will remind you as you see the visual imagery, what's going on. So I'm going to read this in English, and you visualize, just put the pictures in your head. Don't think about interpretation. Just put the pictures in your head. Visual pictures, a video, make a video. I usually go to bed at 11 p.m. Then I usually wake up in pain around 4 a.m. and toss and turn and try to get comfortable. Sometimes I put my feet up on pillows, and then I usually doze off until I wake up for work. So, who can repeat back what I just said based on visual imagery? Anybody want to try?
I'll try.
Okay, Jose, go for it.
I usually go to bed at 11 p.m. At 4 a.m., I wake up in pain, tossing and turning. I put my feet up on a pillow, and then I doze off until I wake up. Something like that.
That was pretty close. That was pretty darn close. The only word you missed was the word comfortable. The rest was just basically the order of the words, which doesn't matter. So that was awesome. Good job. So what visual pictures did you have in your mind?
I had just pictured myself in bed next to my alarm clock with the time on it. So I had just the alarm at 11, and then me waking up at 4 a.m. tossing and turning, and then putting my feet up on pillows. So I've done that before. So that's pretty much it.
Okay. That was awesome. Visualizing is so helpful to be able to keep track of that. All right, let's try counting. So in your head, I want you to recount the list I'm about to give in this paragraph and see if you can do it if you can remember all these things. Ready? So that we're practicing the counting skill, listing with numbers in your mind. Have you or anyone in your family suffered from a serious disease such as diabetes, cancer, heart disease, or glaucoma? Who can tell me back the list?
Is diabetes, cancer, heart disease, glaucoma?
You got it. Just keeping them numbered in your head, just remembering that there was 4 things. Even if you didn't number every single one of those, just remember that I said 4 things can force you to think back, okay, what was the second thing, the third thing, and remembering by just numbering diabetes, cancer, heart disease, and glaucoma. All right, so keeping a list in your head. Let's try something else here. Chunking. All right, here's an example. So you want to chunk things up so that you can remember everything that was said. Either you can number that or visualize that, or just keep them as separate chunked up ideas in your mind. So here's an example. Have you had any symptoms such as dizziness, shortness of breath, heart palpitations, numbingness in your hands or feet, confusion, or memory loss? How could you chunk those? I'll read them again. I'm not asking you to do this one too quickly, but I'm going to read the list one more time. How could you chunk these so you could remember them all? Have you had any symptoms such as dizziness, shortness of breath, heart palpitations, numbness in your hands or feet, confusion, or memory loss? How might you chunk those ideas up?
Well, dizziness is a because from short of a breath. If someone has a short of a breath, can be a dizziness, and also it's kind of a heart palpitation. It's hard to just palpitate, and also just there is a no the body circulation is a problem, so that's why just numbness hands and feet, and also it can be like a loss of consciousness, like a loss of consciousness. And also, then it can be, loss of memory at the end. Yeah.
Yeah, you got them all. So it sounds like you kind of connected those to things that you could put them into a category for yourself. And everyone might have done that differently. So one thing you could do is, dizziness, confusion, and memory loss, all of those are kind of in your head or brain. So you could chunk anything related to the head there. Heart palpitations and shortness of breath, that could be kind of a chest area of your body. So this is different than the way you did it, Hong Suk, but that's fine. Whatever works for you is the way you do it. And then another one would be numbness in your hands and feet. You can just think of the extremities of the body and just put those into that kind of a chunk. There's no right or wrong way to do this. Whatever works for you to chunk things up, that helps. All right. Last one for memory that we need to talk about is note taking. So this can be something that you might want to mention in your pre-session with a patient or with a provider. So let's review what a pre-session is. So who can tell me what you would say in a pre-session with a patient?
Is that when you first met the provider and the patient there and you're just laying the ground, hey, this is what we're gonna do, whatever thing you say, I'll say it. Just always address the provider directly, even pretend I'm not here, whatever. And in this case, if needed, I'll be taking some notes, but don't worry about it. Just ignore me completely.
Perfect. So the concerns people might have with note taking is that you're writing down private information. And so the only thing I would add to that, Santiago, is I will destroy the notes when I'm done. This is just to help me be able to interpret and not miss anything. And as long as you tell them why you're doing the notes and that you'll destroy it after, that's what matters. But you might have to talk about this with them so they know what you're doing, because if you're writing things down, they might get a little bit apprehensive about what are you doing? Why are you doing this? So for sure, explain in a pre-session why you're taking notes. Make sure they give permission. You might need to ask, is it okay if I take notes? And if they say no, you're going to have to figure out how to do it without it. But I think to be safe, you should always ask for permission to do that first. Be discreet. Don't have this huge honking notepad with, papers that you flip around and that draws attention to itself. Generally, you want to have something small that's not going to be noisy and that's not going to be distracting, that you can just write down a couple of quick thoughts, write down a word or two, a small list, and that's not going to be noisy or overly distracting. Don't be too obvious about the notes. And then for sure, destroy the notes. Try to destroy the notes when you're done in front of the patient and the provider. Let them see you tear it up and throw it away so that there's a peace of mind there that comes. So yeah. When it comes to note taking, you might need to develop some symbols and shorthand for yourself. Some ways to write things that are quick. I haven't been in college in a long time, but I didn't get good at this in college either. But when people are talking this quickly, you don't have time to write down every single letter. You don't have time to write down, you don't have time to spell everything out correctly. And something I've found is that if I'm using a pencil, I have a tendency to want to erase something if I spell it wrong or something, because that's the way I was taught in elementary school, is to go back and erase a mistake. So to avoid that, I would use a pen. So you can't erase, at least if that's your tendency. Maybe it's not, but for me, I have to use a pen. If I use a pencil, it'll mess me up. Using a pen so that I can't go back and erase things, that takes time. Just write enough, kind of like what we did here, just to jog your memory. Shoulder, fall, cut. You don't need to go through and write down every single word. Sometimes leave out the vowels. If you just write a couple of consonants, that might be enough. So instead of writing shoulder, you could write shoulder, and that might be just a little bit faster to jog your memory. This takes some practice. I don't use notes when I interpret, because it's its own skill. And the way my brain works, it'll slow me down. And maybe I just need to take the time to actually practice using notes. But for all of you as relatively new interpreters, it's a good skill to start out with as you're learning to develop. I just haven't gotten good at using notes. But practice it, and don't feel like you have to do it perfect the first time. You're going to kind of develop your own way over time of taking notes so that it's faster and more efficient. It should get to a point where the note taking is automatic and you're not thinking about how to correctly take notes while you're trying to interpret. It should be something that just the writing comes automatically. I know a couple of interpreters that when they're taking notes, they don't even look back at them. For some reason, just writing out as much as they can while somebody's talking, even if it's just a letter for a word here and there, just sometimes that is enough for them to just solidify what's being said, and they don't even look back down at their notes. So this is something worth kind of tinkering with and seeing how this works for you, if it works for you, how you could do it better if it does. and then just practice it, practice it, practice it. So yeah, that is memory development for interpretation. Those are the main points that I felt like we should cover for memory development. Any questions? I don't know if I have all the answers, but any questions about memory development or anything else we've covered so far in our trainings? Okay, I got a memory quiz. Who can remember all those things, all those different skills we just talked about without looking at your notes? I don't know if I could actually. I think I could. Concentrating, visualizing, repetition of commonly repeated phrases, counting, chunking, and word association, linking, and connections. So those are the ones that we have. All right. That's that topic. We have, let's do one more topic here, and then we will, well, if we do both of these, do we have time for both? It's 8:20. Yeah, let's continue here. Site translation. I wanted to spend just a few minutes on site translation, and then I want to give you an opportunity to practice site translation. So I have something here for you that I will put up on the board. But let me when you are site translating, this is, if you don't remember, this is when you're given a document. We do not, as interpreters, we don't write anything out. That would be translation. That's a different skill. That's something that if you want to translate, you would want to be paid separately for that. So don't ever translate. But you can read the document. This is what site translation is. The rules are you have to interpret, you have to site translate with a provider in the room for two reasons. One, you're never supposed to be alone with the patient. Two, you need somebody there in case you have to switch from conduit to clarify. You might need to clarify something that either you don't understand how to interpret or that the patient doesn't understand and they want to ask a question. You don't want the patient asking you a medical question. Even though you can read the document right there, you shouldn't be explaining that document. You're just a conduit. And so if there's a medical question about, like the one that comes to my mind is all the immunization instructions after you get the flu shot or something like that, right? You would want to have somebody there to answer any of those kinds of questions if they had any. When we site translate, even though you have a document right there, we are still following the same rules of conduit, which means you're interpreting everything that is there. You're leaving nothing out. You're not adding anything, and you're not changing anything that's on that document. Let's see here. I have one that I'm going to put up here, and I'm just going to give you a minute to site translate this. So let me put it up here. If I can get this. Not here. I lost it. You might have to just skip it. We'll do it as part of our role plays. That's okay. I'll provide you some documents so we can practice it. The best thing to do if you want to practice this is when you're in a clinic, when you're in a doctor's office, grab some of their materials, like their brochures, and then just read it in the other language. Just read it in Spanish, read it in French, read it in Korean out loud, and try and do it straight through and just see what your weak spots are. The more you interpret, the more you'll get used to some of the kinds of documents that providers give all the time. And you might be able to find out if some of those things are already translated into Spanish, especially Spanish. Korean, Arabic, and a couple of the other languages, maybe not quite as much. But a lot of documents at this point, with this many refugees and this many different cultures in the Boise Valley, a lot of these documents should have been translated. And if they haven't, then go ahead and site translate. But this is a skill worth practicing. When you're in the lobby and you're just waiting to go in and they haven't called the patient back, grab one of their brochures and just read it to yourself from English to Spanish or English to Korean, and just practice that, and so that you can get better at that. All right. We've talked about culture, but I want to talk about culture in a little bit more detail than we talked about before, in a little bit different way, specifically how to be a cultural broker, and cultural issues that you might run into that aren't on the advocate level. So we don't want to have to go so far that we're acting as an advocate, but we do want to clarify and explain culture. So first of all, how would you define the word culture?
I'd say it's your practices and beliefs related to the area that you're in or were raised in.
Yeah. Yeah. A lot of those things, practices, beliefs, values, sometimes there are even assumptions. There are premises and starting points that people just assume everyone believes or understands or thinks that, and they might not. And so this can affect the way we interact with people, and can cause a barrier. And sometimes we don't even notice it because it seems so obvious to us what we're doing, what my culture is, that it can cause some communication barriers. And for any of you that are married, you know that any kind of a family relationship where two people are coming from different backgrounds, even within the same country, same culture, if you will, every family even has their own culture, their own ways of doing things. And so we have to learn to adjust to those kinds of things. And we can't assume that just because something is typical in a culture, that individual sees it that way, because everyone kind of has their own active culture. So there's a difference between general culture and then there's your active culture, which is on your personal level. There's your history. There's your not just where you're from, but your family and friends and the way they interacted with you. There's the primary language that could actually bring some cultural with it. But education level, even within the same country, the level of education can totally change a person's cultural demeanor and behavior. Their religion, especially when we're talking about some of the refugee communities that are here from the same country, but some of them are Muslim and some of them are Christian and some of them are totally different. And just that alone, even though they're from the same place, has some differences. And we can start to make assumptions that aren't necessarily true. And sometimes those turn into discrimination if we start lumping things together, right? So we never want to assume anything, no matter how much we've gotten used to a particular general culture. We need to be careful that everyone has their own active culture. If they've had different economic, financial history, that can cause a different culture. Just generations can cause a different culture. So my grandparents coming out of the Great Depression, they don't throw anything away. They have scraps of metal in their yard that have been there for 20 or 30 years that nobody has ever touched, but don't you dare try and throw it away because you never know. And that, I grew up right there, not far from them, but that right there is a totally different culture. And yet same ethnicity, same area, same location, just the generational difference and the history of economic experiences being different. So it's important that you realize that there's going to be some general cultural things that you'll run into, but you also have to be aware and pay attention, especially when it comes to body language, when you can tell that there is a cultural difference that might be out of the norm, and you're going to have to stop the communication. And it might be for you to understand. Maybe you are confused because they're saying something or doing something, or they're interpreting something in a certain way, and you're confused and the provider is confused, and you might have to clarify and stop and try to figure out if there's some sort of a cultural issue here that's causing a miscommunication or some sort of a barrier, which means, and we talked about this with clarifying when it comes to language and conduit, but this applies with culture. So you want to pay attention to people's body language, their tone, their pitch, gestures, posture, eye contact. In some cultures, eye contact is inappropriate, especially if there's different genders. That it's just not appropriate in some cultures for men and women to look at each other in the eye, because that can either be threatening or interpreted a certain way, or it can be domineering, and it can be all kinds of different things. And again, active culture could be different for a person. For one person, eye contact is a sign of confidence. For another person in the same culture, because of their history, eye contact could actually terrify them just because maybe they've been abused or it triggers something. And so you want to be watching for all of these kinds of subtle things that could inhibit communication or cause a barrier between them and the provider. And if you see any of that, you're going to want to intervene and stop and help. So also proximity. We love our space here in the United States. We like distance, and some cultures, they're huggy. They want to be right up close to you when they're talking, and so there's a lot of those kinds of things that you have to be aware of when it comes to culture. On top of that, when you face a cultural conflict, sometimes you will have to help both parties to understand so that there isn't offense taken. So sometimes it's not about medical diagnosis. Sometimes a patient could be offended by the way the doctor is talking to them, or threatened, or misinterpret. And one of the ways this can happen is the way we joke. And some of our jokes aren't, you can't interpret them. They just don't go across languages. And some of the way that Americans joke can be sarcastic. And it can even be offensive for an American to be to have a provider be sarcastic with them. And so this is something that is not just across language and country barriers, but there could be a way that a person is communicating that could really shut down somebody and offend them or hurt them or totally be misinterpreted in a way that can shut down a relationship. And that would be your role to help navigate that a little bit. Because some sarcasm might seem harmless, and yet a provider might need to be, you might need to help them understand that that kind of sarcasm will be extremely rude to this patient. So you might actually have to wait to interpret something, clarify with the provider first, explain the culture, and then ask, do you still want me to interpret that? Can I say that a different way? There is a little bit of a role for that to help maintain that relationship. You don't want to take it too far, because then you end up being the culture teacher, and that nobody likes that either. So you want to balance that for sure. So that is, there was something else here. There's some things that culturally can cause some issues. And I don't remember in which of the classes, because some of you did different classes. I can't remember which one we talked about this in, but this is starting to get into the advocate culture role, which is that sometimes the culture of medicine in a country is totally different. In some countries, the doctor comes in, they do all the vitals, and then you never see the doctor again. And the nurse comes in and gives the diagnosis and gives them the treatment, which is totally opposite of what we do, right? And in some cultures, they don't tell a person that they have cancer. They tell the family, and everybody knows except for the patient. And that would never happen here in the United States. That can cause some cultural issues. The way some things are handled could be different depending on that. For instance, when it comes to that, informed consent. Before anything is done in our culture, the provider asks the patient if that's what they want to do. And the patient is told of all the risks, and then the patient makes the decision. Even when a doctor makes a recommendation, they still let the patient say no or yes, or is there an alternative? In some cultures, that's never going to be appropriate for a patient, where they are actually going to feel like, you're the doctor, you know better, you do what you need to do. They don't even want to know what the treatment is. Just put me under and do it. And so helping a patient to understand that on a cultural level could could be a little bit complicated in explaining that. So remember that here's the risk when you're being a cultural broker is to do too much of it. Your job is to facilitate communication. Your job is to make sure there's correct understanding, and that's it. You don't want to have any misunderstandings that could lead to undesirable health outcomes. And your cultural brokering and explanation shouldn't go any further than that. It's fun sometimes. It's fun to talk about different cultures and weird things that we do and things like that. And we all love to learn about that, I think. But that can be taken too far, where we're explaining way too much about culture, and it's actually causing more barriers than you're actually solving by getting in the way of too much of the communication that's necessary. So I've got an example here. An oncologist asks an advanced cancer patient who wants to return home to Peru if she will have access to adequate medical care there. She says yes. However, adequate medical care may mean different things to the patient and the provider. The patient may envision a public clinic with minimal stocks of medicine, while the physician envisions a full-service hospital with hospice and other full-service care. These assumptions can lead to misunderstandings that could negatively impact the patient. So how would you act as a cultural broker in that situation?
Step in and ask as an interpreter role to the provider to elaborate on what adequate care would mean so that you can explain it to the patient.
Yeah. And in this case, you might want to incrementally, right? So you might want to say to the patient, the interpreter would like to clarify what the provider meant by adequate care. And then you turn to the provider. As the interpreter, I would like to clarify what you might mean by adequate care, because the patient is going to a rural area that might not be the same thing that you're thinking. And then allow the provider, if you can, allow the provider to then have that conversation with the patient, and you go back to the conduit role as soon as you can and let them have that cultural discussion. And try and stay out of that as much as you can. So, but it wouldn't be wrong to intervene just to clarify, to make sure, and then if so, explain the cultural difference if that's required. Okay, here's another example. When a provider comes into the room with her head buried in a chart or laptop and begins to talk to the patient without even greeting the patient. To save time, the provider gets right to the patient's concerns. The patient, however, may believe the provider's lack of greeting indicates a lack of respect or courtesy, and this could prevent the patient being willing to open up to the provider. What might you do, if anything, in a situation like that, where the conduct of the provider could potentially create a problem on a cultural level? Is there any intervention, and what would that look like?
I would say no. I would wait until the patient either verbally or through body language expressed that displeasure before I intervened at all. Otherwise, I would just be a conduit.
I
Yeah.
was gonna say, they would show with the way they react. I had, yeah,
Yeah, I think you'll see it. And I wouldn't intervene unless you really see, okay, this is causing major problems. Let it go. Let it go if you can.
I have the provider usually tell me like, just let the patient know I'll be doing this. And it's not that I'm ignoring them or turning my back on them. So
That's a good idea. And you might just have to say that to the patient, right?
mhm.
So that they know that the provider is doing that.
like 6 or 7 years ago, it happened to me that the patient started crying. And the doctor wouldn't even realize, and it was walking pneumonia. We would say pneumonia ambulante, which I learned after the appointment, by the way. And what happened was that in Congo, the guy was from Congo, the patient was from Congo, and there people die when they hear the word pneumonia. They're like, okay, I gotta talk to my friends and family. And this was different. It was walking pneumonia, and the doctor was not even sending him to the hospital. He was sending him home. So he was thinking automatically, okay, there's nothing they can do for me. This is it. So I had to tell the doctor something here might be happening. I'm sorry. Are you okay if I ask the patient? And that's when it all came out. I had no idea either, to be honest. So I think you're totally right.
Yeah. I think that's the right thing to do. As long as whatever you decide to do, you're transparent about what you're doing, that both parties know the interpreter is interjecting and for what reason, right? So, and you need to tell both parties what you're doing. The interpreter needs to clarify with the patient why they're emotional. Would that be okay with you? You seem very, or allow them to have that conversation and you go back to conduit, but always be transparent when you're interjecting to clarify those kinds of cultural differences or what might be going on. So hopefully the provider can just notice they're crying, right? And they have a soul and they can actually, start asking questions on their own and you can remain in a conduit role. But it would be appropriate to intervene just to make sure and make sure that there isn't any kind of cultural or other issue, right? So it might be cultural, it might be advocacy that you might need to actually go that far on. So as long as you're transparent, that's what matters. Whatever kind of intervention you're doing, and get back to conduit as soon as you can. What if the cultural difference is funny to the provider and they laugh? What if it's funny to you? There are things like this that are just weird to us sometimes here in the West. I started to be nice to my mother-in-law, but she has so many weird ideas about where diseases come from. I don't remember which class I told you, but women are not allowed to sit on the cement in Russia. They will freeze their ovaries and never have children. And I even COVID, when COVID started, it took us months to help her understand that this doesn't come from the windows being open. That a draft is not going to cause COVID. And some of these things can be a little bit funny to us, right? And so you might explain a cultural thing to a provider and they might laugh. So how could you prevent that? Or what would you do in that kind of a situation? With family, it's different. We tease each other, but in a doctor's office, you probably don't want to be teasing patients, right? So how do you prevent this? And if it does happen, what do you do?
I think that's where tone comes in. I really don't know how you prevent that though. If somebody says it and then laughs, I don't know.
Can you reword things like in another way so it doesn't sound, funny or something?
So that's exactly right. Like the way you explain this to the provider is going to create a reaction. And you want that reaction to be respectful, which means the way you talk about the culture needs to be respectful, as absurd or weird as it might be, whether it's evil eye or witchcraft, which is a real thing. You'll run into that. I'm not kidding. If you can show respect as you're explaining it to the provider, and the way you word it can create the respectful reaction from the provider that you would want them to have. So you might want to preface it by saying, in their culture, they don't have the understanding of medicine like we do here, and so therefore they have a belief that. And I don't know, you would have your own way of phrasing it, but the way you say it, your respect and the way you talk about the culture will create that in the provider. And we don't want to, by the way we talk about other cultures, create a new stereotype that could lead to that provider stereotyping other people in that way, or reinforcing false stereotypes. And so by being very careful to not reinforce stereotypes and saying it very respectfully, I think you can avoid this. So.
Well, to me, it's a little bit hard. I'm not going to lie to you. I mean, I do want to make it respectful and everything, but at the same time, I feel like I am not being 100% honest because I am adding stuff. And I feel it's part of also the professionalism from the provider. And if he's a jerk, let's say it, well, also the person has the right to say, you know what, seeing how you reacted, I think it's time for me to get somebody else. I feel like I'm watering it down a little bit. I do get what you're saying, but it's a little bit hard. It's difficult for me. I do feel like I'm changing a little bit what's been said originally. You know what I'm saying?
Are you changing what's being said as the patient explains their culture, or are you changing what's being said so that it doesn't cause a cultural misunderstanding? Like, what do you mean by changing it, I guess?
Well, if the person says, I have evil eye, I would literally say, I have evil eye. And then I feel like if the provider has questions or something, he can always ask, and I'll just translate whatever question he or she has. I will try to sound professional, and I will not word it in a funny way or say, oh my goodness, I can't even believe some people nowadays believes these things. I would never do that, of course, but it's a little bit hard for me to add things that the person didn't say. I do get what you're saying though, and I would probably try to implement that.
Well, no, actually, what you just said is what you should do. You want to interpret as a conduit. You don't want to explain the culture unless you have to, because the provider is confused, or they're making, maybe the provider starts to laugh because you said evil eye, and they're like, what the heck is that? And they start to laugh. Then you know that you need to intervene as a cultural broker.
Beautiful. Thank you so much
Yeah.
for that. Thank you for
Yeah,
clarifying that.
Yeah, don't jump straight to
clarified.
cultural broker. Watch for the body language, watch for reactions. You function as a conduit. And if the provider doesn't know what evil eye is at this point in Boise, Idaho, then you can explain that one. But try not to have to explain culture unless the health outcomes are at risk. That's the only reason you should have to do it. And it might be that the provider laughs, but he just goes on and continues with the medical interview and is able to give a proper diagnosis. Then even though the provider didn't understand the culture, it wasn't necessary to explain that just because they chuckled. So you want to stay in the conduit role unless the culture causes a barrier that could lead to unhealthy outcomes. Stay in the conduit role as much as possible. It's fun. Like I say, it's fun to talk about culture. We want to explain it. It really is. It's a fun thing to do. But if it's not necessary, don't.
Actually, I think I have a
Thank
good
you.
example.
Yeah.
So I work in gastro department. So I had a Hispanic patient come in and he had fluid buildup in his belly. So my provider prescribed diuretics, which are supposed to take the fluid out of your belly. His wife happened to be Hispanic as well, gave him the herbs or teas of herbs or natural teas. And she thought that's what got rid of the fluid in his belly. And I explained this to my provider, and so he kind of chuckled a little bit too. He's like, no, so I want you to explain it to her that it wasn't the teas, it was the like 3 diuretics I have him on. But I want you to explain it to her because if not, what they were planning on doing is stopping the medication and just being on the teas, which he's like, no, he needs to be on the medications.
Mm-hmm. Perfect. No, that's a great example. That fit just perfectly. Yeah, you'll come up. You'll accumulate stories to tell. I promise. You will. You will. Let's see. I've got a couple of examples here. So you might need to intervene as a cultural broker when a patient who's being seen by a resident insists on being seen by a real doctor. Or they're being seen by a nurse practitioner, right? I want to see a real doctor. And you might have to explain that a resident is a doctor or that a nurse practitioner is basically a doctor, right? It's just a different path towards that. A patient feels like they only have 15 minutes with the doctor and that is a sign of discrimination. So explaining the culture, you wouldn't have to go to advocacy on this, but you might need to explain the culture of medicine in America. The patient doesn't understand why the clinician is focused on looking at the computer instead of looking at the patient when the patient is trying to describe the problem. You might have to explain what the provider is doing. They might not know. It looks like they're distracted or doing something else, but the provider is looking at symptoms. They're documenting. They're writing things down. Right? There's so many things the provider is doing there, and as a cultural broker, you may need to explain that to the provider and say the patient, as an interpreter, and I would like to explain that the patient feels like you're not paying attention because of looking at the screen. You might want to explain what you're doing so the patient understands why you're looking at the screen. And then go back to conduit if you can. I don't know if that's the best way to do it, but don't be afraid to intervene and explain culture on either side. So, let's see. I've got some more examples here. These are fun ones. There we go. Here's the first one. Whoops. There we go. So, a patient from Peru is with the doctor. Doctor says, Mrs. Chongora, I know you want to go home, but I'm concerned about your medical needs at this point. Will you have access to adequate health care? Oh, yes, there's a hospital in my town. Well, in that case, maybe there's no problem. The interpreter understands that there might be a cultural, this is kind of the other example we had earlier, that in her place in Peru, her idea of a hospital might not be the same thing that the doctor has in mind. So the interpreter intervenes by telling the patient, this is the interpreter speaking. I'd like to mention to the doctor a little information about the healthcare system in Peru. Would that be okay? Patient, yes, that's all right. So the interpreter then explains to the doctor briefly what the culture and medicine is like in that part of Peru. The interpreter then allows the doctor to decide what to do. You've done your job as a cultural broker. You switch back to conduit. Doctor, that would be a concern, Ms. Changara. Tell me exactly what you mean by hospital. Would they have an oncologist there? Could they hospitalize you if necessary? Would there be a pharmacy where you could get a prescription for painkillers? Patient, well, not really. I guess it's not a hospital really, but there is a nurse there most days who could give me an injection. And there's a pharmacy in town where you can buy anything and you don't need a prescription. So the interpreter switches to conduit. They've clarified everything and the provider can make those decisions and counsel as necessary. Let me do one more here. Cultural broker. You are interpreting for a patient at a routine doctor visit. The nurse asks what kinds of medications the patient takes, and the patient shows the nurse some medications that a friend sent her from her home country. The nurse is confused about how the patient got those medications without a prescription. So in this case, you may have to explain to the provider that some countries you can get anything without a prescription. Let me do one more here. You're interpreting for a patient in a small clinic who is there for physical for their job. The patient also brought their 2 small children and asked if they can be seen during the same appointment. That happens a lot, I think. That would be inappropriate. You might have to explain to them that they can't do that. And so you may have to interject as a cultural broker there. But again, you want to stay in a conduit role if possible. You might not have to be a cultural broker in this situation. Just being a conduit and the nurse being like, why do you have your kids here? You just continue in the conduit role and let the nurse or the receptionist or the doctor explain if at all possible. So that is cultural broker. We will have a whole separate lesson on advocacy, and so we'll save that one for next time because I don't think we have time to do all of those. I think we'll call it good for today. I know it's only 9 o'clock, but I think if we do 7 to 9 next time, is that better? Is everyone okay if we start at 7 so we can end at 9 next time as well. I just wanted to make sure they had already scheduled a bunch of you for 7:30, and they didn't want to confuse everybody. So I think everyone was confused anyway, but if we want to do 7 for next time, is that okay? Okay, we'll do 7 to 9, and we'll just do that from here on out till we get this all done. Thank you guys for being here, and hopefully you can use some of this, practice it. And then if you have any questions, let's talk about it. I'd love to have conversations about what you've experienced with any of these things and how to handle situations. And the more we go along, I'm sure the more questions and stories you'll have. So feel free to share next time, or if you have any questions between now and then, go for it. All righty.
Good. Thank you.
Okay. We'll see you guys next time.
Thank
Thank
you.
you. Good night,
Bye.
everyone.
Bye, bye.
Good night.
Bye.